acne treatment, that is a global algorithm, alliance algorithm. So here first we are looking at the first choice. In case of the first choice, what we see is in mild. In mild, we have the comedonal. So in case of comedonal, there is the topical retinoid, and next in case of same mild and in case of papillar as well as the pustular, it includes the topical retinoid as well as the topical antimicrobial. Now next what we are looking at is the alternatives in case of mild. So the alternatives, it can include, this is for mild comedonal, so all topical retinoids can be administered, or the azelaic acid and the salicylic acid. Now looking at alternative for females in case of mild comedonal. Alternative for females is nothing but it's similar to the first choice, that is the topical retinoids. Now looking at the maintenance therapy, it is also by the topical retinoid. Next we are looking at the pustular, the papillar and the pustular. This is in terms of mild. So what we previously saw was it is again topical retinoid, and there is also a topical antimicrobial. Now looking at the alternatives. Alternatives, what we see are the alternative topical antimicrobial, and this is along with the topical retinoid as well as the azelaic acid. Now looking at the alternative for the females, it is again the same, that is a topical retinoid and the topical antimicrobial. Now how to maintain this? In case of maintenance therapy, there is a topical retinoid along with the BPO plus or minus BPO. Now looking at moderate. In case of moderate, we will be first looking at the papillar as well as the pustular. In case of moderate, it includes the oral antibiotic as well as the topical retinoid plus or minus the BPO. Next, in case of the alternatives for this, it can include the alternative oral antibiotic and the alternative topical retinoid plus or minus the BPO. Now alternative for females. Females is the oral anti-androgen along with the topical retinoid or the azelaic acid plus or minus the topical antimicrobials. Next what we are seeing is moderate nodular. So in case of moderate nodular, it includes the first choice, it includes the oral antibiotic along with the topical retinoid plus or minus the BPO. Now we are looking at the alternatives. So the alternatives, it includes the oral isotretinoin or the alternative oral antibiotic along with the alternative topical retinoid and plus or minus the BPO or the azelaic acid. Next, moving on, we look at the alternative for the females. Alternative for the females, what we see is there is the oral anti-androgen along with the topical retinoid, plus or minus the oral antibiotic, plus or minus the alternative antimicrobials. Now we are looking at the last stage, that is the severe stage. Severe, here there is nodular as well as the conglobate. So here the first choice is the isotretinoin. And next, moving on to the alternatives, it includes the high dose oral antibiotic along with the topical retinoid along with the BPO. Next, what we are seeing is the alternatives for the females. In case of the alternative for the females, what we see is there is a high dose oral anti-androgen, and this is along with the topical retinoid along with the alternative topical antimicrobial.